Yeah, that's good. Thank you.
Okay. Good afternoon, and welcome again to this week's episode, I suppose, of Imperial as One's Belonging series, series of candid interviews exploring the BAME experience. I'd like to thank you all for coming, and this week we've got the pleasure of having Dr. Marian Chan with us. And Marian Chan is a consultant rheumatologist and clinical lead with responsibilities for the same-day emergency care and for ankylosing, I knew I was going to get this one wrong, spondylitis rheumatology at Luton and Dunstable Hospital. I was practicing that for about 3 or 4 minutes trying to make sure that I would pronounce it, and I messed it up. But never mind.
You did really well. Thanks, Wayne. No, well done. It's quite a long word.
So I'm going to hand over to Marian. And Marian, if you could just tell us a little bit about yourself, about where you're from, about your role and your responsibilities, and then we'll get into the discussion. So I'm going.
Great. Okay. Well, so hello everybody. Thanks for joining us, and thanks Wayne for the invite, for allowing me to share my experience. So yeah, I suppose you could call me as a confused individual. I'm of South African origin, actually. But my parents came from Hong Kong. My mum's from Hong Kong, and my dad was South African. So I'm basically first generation South African. So I was born there, and I did all my I grew up there, and I did all my university there, and I trained in medicine at the University of Witwatersrand. And then I decided to pursue my postgraduate work in the UK. So I've done all my postgraduate training in general medicine, and I was very fortunate at some time point, because of some visa issue, where there was a time in the UK where non-Europeans couldn't train. A friend asked if I would like to accept a job at Oxford as a research fellow and a registrar. So I took that opportunity because it was a non-training job, but it kind of worked out really well, because that's where it aligned my stars to become a rheumatologist. So I was very fortunate, and I was given an opportunity to work as a research fellow in mellariostosis, which is a very rare condition. And I must be thankful to Paul Wordsworth, who was my supervisor. And I think that opportunity really did steer me going ahead forward, because I thought I wanted to be an oncologist in the beginning. Yeah, but to be fair, I didn't like the idea of putting every moribund patient on a clinical trial. Although I knew research was important, it didn't really agree with my personality. So I think rheumatology in a way worked well for me, and I learned so much. And then following my 2-year as a research fellow, I then moved on to formal training as a rheumatologist. And I did that up in Mersey, up in Liverpool. So I've worked there for 6 years, and then, I decided to apply for a job back down south, because I wanted my child to grow up in a more diverse kind of environment. I think it's also Heathrow Airport is closer, and it's easier to get home to South Africa if I needed to. So that was one of the reasons why I chose to come. And I must say, Luton specifically I chose is because it reminds me a lot of South Africa, the diversity, the patients. It's South African hospitals are very busy, chaotic. But we all seem to, we had very good basic training. We were thrown in the deep end, but we managed to get through it. And I suppose the Luton environment, it's not, it's very busy, but somehow we managed, in an organized manner to get through it. And yes, the facilities are not beautiful, but I think patients in general get good care. So this is where I am now.
Okay.
Yeah.
That's brilliant. That's brilliant. Now, you mentioned that you were your first generation South African, and how when I think of South Africa, I think of when I was growing up and the issues around apartheid, etc. in South Africa. What was that experience like for yourself? How did you get your sense of belonging in South Africa at the time?
So I think I grew up through some key transitional times in South Africa. So from my parents' generation, they were segregated during the apartheid time to live in certain areas. So, in fact, growing up, we grew up in an area where Africans, Indians, and Chinese people were not allowed to kind of, segregate into the white area. So they had different zones almost. But I think I would say my parents' generation, they were the ones that experienced that, because they used to have to go out with passes, restricted to certain places, etc. So, and for them, they had a business that they opened, but they couldn't use their names to register. So they actually had to register it under a white person's name. And somehow, you became friends with the person who were allowed to register names. So I think and based on where you lived, that's where you could go to school.
Right.
So, and obviously, unless you went to private school. So, but my parents always felt it was very important that we got good education. So for them, we didn't live a luxurious life. They worked very hard. They came from nowhere. They basically came on the story is, they came on a ship and they landed in South Africa, and that's where they started, and life was hard, and every penny counted. They started from nothing and they developed a really good business, and but for them, they always said education was the most they can give us, and that's the only thing they're going to give us. So,
yes.
So they believed in investing in schools and stuff. So I was very fortunate. I was able to go to some, I was fortunate to go to private schools, and I did meet different people. But there was and so in my primary school years, I went to private school. But there came a point in South Africa, I think in about the 92 era, where we could kind of move out of the area where we had to live. So we were able to go to the more white suburban areas, and we were allowed to integrate, and there were very good schools there. So then I was able to go to that area school. So it was quite revelatory in that way, because it was like, oh wow, we get to move out and we get to go to, school. And that's where I went to the government schools, and they were very good, and increasingly you could see as things evolved, we have more of our Indian counterparts, our Black students, Chinese students. So, that's where, so I think for me, I was young enough to kind of realize, kind of old enough, I suppose, to realize what my parents had been through and the restrictions, but also young enough in the sense of when Nelson Mandela kind of was freed, and he said, this is all going to change now. We are a rainbow nation. And I think I have been part of that. I've seen that the tolerance and the exception to cultures and things have grown. Don't get me wrong. There is still very deep underlying racism in the older generations. But I would say, I think in my generation, we're aware we may be different, but I don't think we started to see each other as individuals, not as according to your color. Yeah.
Right.
Yeah. Basically.
So it's no longer a homogenization because of skin color or anything like that. You're actually seeing people for their individual traits.
Absolutely.
How you talked about school? How did you find school? How inclusive, and how was your sense of belonging whilst going through school?
I think during school, perhaps I was naive and I didn't notice the difference, but I think certainly in private schools, I didn't notice that much of a difference. I didn't feel that I stuck out, if you know what I mean. I felt I made friends. I had every color friend I wanted. I had an Indian friend, I had white friend, black friend, white friend, many types of friends. So I think in a ways I felt inclusive in that way. I didn't feel left out. I didn't feel that we segregated together at all. So and certainly with the government schools, I think it was the same. We tried to, we integrate, we integrated well, and we had all sorts of, nationalities and cultures. And it was actually really interesting to be able to understand different cultures. And I love food. So like for me, anything culturally linked with food, I would, that's the talk, and so I think, I did grow up in a predominant Indian area, so I kind of understood their culture a little bit more.
Yeah.
But obviously, you know, and when you go to school, you're able to have jokes about each other, you know,
Yeah.
cultures.
Yeah.
So, you know, we knew there was racism, but we could also use it as, you know, as for fun. You know, we could joke about it. So you can say like, "Hello, my black brother. How are you doing today?" Or, "How are you, my brown brother?" You know, it was never like taken as offensive. You know, so we tried to break those barriers. Yeah, it was definitely harder for my parents' generation, I think. Yeah.
Right. Okay.
Yeah.
And I suppose as well, because of the change in the dynamics within the society at the time, there wasn't so much of a connotation of you being insultive or people insulting you in the way the discourse went.
Well, they were still always the insultation of like, "Oh, you're Chinese, ching chong." You know, they would always be the occasional statement. But I think, I suppose you would say maybe we just got used to it, and we kind of learned to ignore it in a way. Because and you know what? Actually, you're right. We were called, but it wasn't often, and I think we just learned to ignore it. And I think we were never confrontational, and my parents' generation were never about confronting things. Because they were so subservient to everything else, they just said, "Mind your own business and just carry on and work."
Right.
That was their motto, really. Yeah. So we never we were never confronted that. We almost accepted that. Yeah.
Right. Okay. So when you came up, did you, because your story kind of like crosses continents, right? Because you go from South Africa and then you come across to the UK. How was it when you made that transition to the UK? Was there anything, did you struggle with fitting in or anything like that when you came here? Or
No, I think I was very lucky. I think because I wanted to make, whether it was because I wanted to, but I think I've always been so fortunate. I've met lots of good people, whether that's local, British born, individuals, or, you know, and I suppose because in the field that I work by nature, there are a lot of international people anyways.
Yeah.
So in a way, you know, there's doctors coming from Pakistan, India, Ireland, you know, all over the world. So it almost kind of, it was great to meet so many people. It almost felt like I fitted in very easily because we were almost all foreigners in a new land trying to make it work. Yeah. So I think in a ways, and you know, I was very lucky. I had my uncle who's a Jesuit priest, and he introduced me to some of his parishioners, and you know, some of our best friends are the people that he introduced me, and that kind of allowed me to settle down and understand some of the British way of doing things. So I think I was very lucky in that sense. Yeah.
So part of the way that you were able to settle in was by getting engrossed with some of the individuals who were here who were more accepting accepting might be the wrong word, but they gave you that sense of welcome, that sense of inclusivity.
Absolutely, yeah, absolutely. I think making I mean, because I lived with them when I first came for a few months. So that, you know, it just rocked up. So that's and I suppose they welcomed me and they included me, and really precious friendships. Yeah.
So would you say that have there been challenging times? Sorry, there's some bit of noise outside today. Have you had any challenging times because of being my ethnic minority? Or would you say that your personality or the way that you've been brought up, you've been able to navigate it? How would you describe?
I think I did find in South Africa that sometimes, say in a ward round or when we did exams or things, I found that perhaps my confidence, I wouldn't be as confident in speaking, and perhaps that was a personality thing. But I think it would be interesting to see how, when I'm trying to speak or a non-Caucasian person was speaking, perhaps it took longer for the point to get through or be acknowledged. So I always found that it might take longer to, not longer, but I would have to work harder to convince my point or demonstrate my capability. And I think and perhaps it was an individual personality thing that I wasn't confident enough in kind of demonstrating that I was able to do something. But I would say, even going back to South Africa, you know, when my dad was quite unwell, and I think I was a fairly confident clinician then. I think coming to the UK has made me more confident, more eloquent in my speaking, and you know, and that probably just comes with experience and as we progress through our profession. But I will say, even going back during that time to visit my dad, when I was trying to speak to my consultant cardiologist colleague who was looking after my dad, I felt that he didn't take me seriously. Now, I don't know whether that's because I felt like, you know, I don't know if that's because I look young or I'm not a cardiologist, but I almost, you know, I think it was quite a shock, you know, when I had to speak up to him and I had to be quite firm. And that is a recurring thing, because I do find in South Africa, it's still amongst the medical profession that we may not be as well heard of or respected in that way. And it does take that little bit longer, but you know, in a way, I don't see that as a problem. I see that as a driver for me to work harder. Now, whether that's because I'm Chinese or an ethnic minority or whatever, I see that as a positive, you know, and because it kind of drives self-learning, you know, to achieve more. And I can't see that as a disadvantage, you know. Yeah.
It's interesting that you said that, in that you were recounting the fact that your point was sometimes not heard, right? And whether you alluded to whether or not that was because you were ethnic minority or not, or to do with your confidence, but the point wasn't heard as quickly as some of your other counterparts. But then you also put it into the sense that one way of combating that is by working harder to prove, and also to gain the qualifications, gain the recognition, to demonstrate that actually I am as good, I am better than those around. Is that a strategy that you would say, and as you said, you didn't feel that there's anything wrong with that because you're improving yourself? Yeah,
yeah, that's exactly what I'm trying to say, Wayne. Yeah. Absolutely. And I think that's exactly how, and that comes from my parents' generation. That's the whole aim, is to work hard so that we can live a better, or give us a better life, you know, because they were all about giving, never about themselves. They never went on holiday or anything like that, you know, they just worked but that's how it is. Yeah. And I don't see it as a problem. I think it just shows that you do need to work to get what you have to do. And I think that's what I want my daughter to understand, is that, you know, I think she needs to understand that nothing just comes, you have to work for it.
It's a common thing which I've heard over and over again, that ability to work hard, that ability to prove yourself. I'm gonna be a bit devil's advocate here at the minute, but don't you think that sometimes when you've worked so hard, and yet you were saying about how you had to be really quite forceful for your voice to be heard, don't you think that sometimes gets a bit tiring, because you know that you know the stuff, you know that you've proved yourself, but yet you're still having to go over and over again proving those points? Does that make sense?
Absolutely. Yeah. There comes a point when you're absolutely kind of fed up or whatever. But, you know, I think being a reflective person, we will always look at ourselves first. And I think that's important to see, can you improve? But yet, of course, it's frustrating when people, and the same people, but then you start looking at the situation and then you look, is it a personal thing? Is it the other person, rather than taking it all yourself? Because if you took it all being yourself as the problem, then you would be heavily burdened the whole time. So you can only do so much. Do you know what I mean? And you're right, you know, but why, if that's not accepted, then, well, let's just move on. I think if we had to hold on to everything all the time, life would be very exhausting. So it is about letting go and maybe trying to see it from the other person's perspective, why, you know, maybe that's more of their issue than mine.
No, I totally understand that. I do totally understand that. That's a very good way of looking at it, because if we do hold on to everything, you're right, either we're going to end up in a mental health institute because there's so many things which are happening, or we'll just not be able to function as effectively as we could do. Considering all that's been going on recently, how do you feel about how we can make things slightly more inclusive for the next generation of medics, next generation of ethnic minorities who are coming through? Is there anything that you can think would make it easier for us going forward? I know I've put you on the spot with this kind of question.
Yeah, you have. I think, I mean, at the moment, you mean as in, do you think that we are not being given the same rights as when for the medics that are coming forward, or the kind of the experiences or the opportunities, or?
I'm just, it's a combination. I'm just thinking about, and I don't want to go down this route because we had discussed this before, but I'm just thinking in regards of opportunities, which many people argue that people from an ethnic minority background aren't given the same opportunities as their counterparts, especially like in the medical profession or in the science or in education. There always seems to be something holding or preventing the progress. Is there anything that you would think that we could do to kind of like overcome some of those, other than working hard? Because I think generally we work hard. So is there anything else that we could do to promote our position, to help others to understand?
Yeah, so I think we need to understand the reasons why we are not in those positions, or is that because we have chosen not to apply for those positions? Is that would you say that, you know, I suppose I'll throw this question back to you because I don't know the data on this, because there might be those posts, but perhaps we are not confident. Perhaps that they have been applied for, but are they not being shortlisted? You know, and then do we maybe not perform well at the interviews, and that's why you're not kind of going forward there? Or different organizations could look into kind of setting quotas, saying that we should try and employ so many ethnic minorities in their companies, and perhaps actively go out and find those talents and individuals. Now, how, are the ethnic minority confident in advertising themselves? Because I generally find that the minority groups are not confident in advertising themselves. And I think that's also something that we need to learn, confidence-wise, because like you say, we're just good at working hard, but we're not good at selling ourselves. So maybe is there a core? Are there courses, or are there mentors? You know, more TED Talks for inspirational ethnic minority people to encourage those individuals to apply for those jobs or those positions that we are looking for. So I think it's a bit of a historical thing. I think, you know, we might not be applying for that. We might not be confident. We might not be talking. We might not be going for those positions. But yes, but perhaps bigger organizations can actively go and balance out and make their organization more diverse. They could do that from an HR perspective, because, you know, clearly there's enough. I mean, I don't know if there's data, but surely there must be, to suggest that, you know, a more diverse organization might be more productive, etc. And using more outcome measures from them, maybe more team working. You know, I think we need more evidence, you know, on that. But how do we generate that kind of, and perhaps with what's going on now, these are rumblings of centuries of problems, isn't it really? So, and I think it's about actually the minority groups not being scared to voice their views as well. And it's taken a long time really for the minority groups to voice their concerns. To be fair, there has never been a platform or a forum, because they've accepted that's how they would be treated.
To an extent, I think, to an extent, you're right. I would agree that it may seem that the voices haven't been heard, or may not have been protesting, but protests in the UK, I know, and protests in South Africa, they had been going back over a large period of time, but yet the voices weren't heard. I do appreciate, and I do agree with you about the idea of that building the confidence. Okay. I'm going to ask you a slightly aside question, because based on your current position, you are the clinical lead for, I'm not going to try and say it again, the ankylosing spondylitis, and also the same-day emergency services. When you were going through the process of becoming clinical lead, for example, was it an easy process? Did someone approach you, or what was that process like? I'm just thinking about it based on what you've said.
So I think it was basic. It was an easy process, Wayne, and that's purely because in the NHS, you know, you do whatever. If there's someone there to do it, then you do it, right? And if there's a need, you do it. So basically, I was just allocated to do it. So I wouldn't say that, you know, I mean, of course, applying for the job, you know, was probably the most competitive process. So I wouldn't say that it was a competitive process where I had to apply for the job, and it didn't work that way. But I think this is what I'm saying. I have been very lucky in the UK to have given the opportunity to do these things, because I think in South Africa I probably wouldn't have had the same opportunities. Yeah. So I think, so in a way in the UK, I think it's a little bit more progressive compared to where I've probably come from, where I may not have been given those opportunities. So it sounds like a very easy process, and I think I'm grateful, but I think I've just been very lucky that I do enjoy what I do, and it kind of just worked out. And so I didn't have to really go fight for it or anything like that. But it was kind of like, do you want to do it, Marian? And I said, I'll do it. And then that's how we do it, right? So,
so you headhunted?
I don't think I was headhunted, no. Not really. I'd like to think that, but no. I'm going to be honest with you. It wasn't a difficult process, no.
Okay. Right. What I'm going to do is I'm going to see if there's anybody who would like to ask some questions now. Otherwise, I've got a few more questions, but I do like to open it up to the audience to find out if they have any questions which they would like to ask. But there are, I'm just having a look. If you want to put your hands up, or if you want to come on mic and ask any questions, then please do. Right. At the moment, I don't see any questions coming in. Okay. I think we've spoken quite a bit about your transition from South Africa to here, the cultural differences, sense of belonging. Let me just have a think. No? All right. You mentioned about your daughter. Okay. I'm going to ask you a question about what you would like to see happen for your daughter's generation. What changes you might want to see happen to make her life maybe easier, or for her to get an appreciation of the kind of struggles which your parents had and which you have had, even though you've been lucky. What would you like to see for your daughter?
So I think what I'd like my daughter to do is, for her, I want her to understand everybody else's culture and see everybody as a whole.
Right.
But I also would like, I think what would be really good is that the children learn the history of the past. So they need to understand where her grandparents came from, what happened, you know, in China, what happened in South Africa. I think that element needs to be taught in history, and colonization, colonialism, not just. So I think it would be great if she learned all the history, to understand why we've come along, but not just her, but the children in her class as well. So I think it needs to come. You know, I think that they need to understand the state. Why is there all this unrest? Where's it coming from? What's going on? And so, yeah, I think that's, and I want her to learn many languages so that she can understand and appreciate people's cultures. And yeah, I think, you know, she's got, you know, and have as many diverse friends as she wants, you know, and, you know, and that's what I wanted to see. But I think the history is very important. I think the children need to understand what's happened in the past and what's going on now.
Yeah.
Yeah, and I don't think that curriculum is very robust in the schools.
Yeah. Okay. I think that's a very good answer. I think it was Marcus Garvey who said, "A man who doesn't know his history is like a tree without roots," and I think that's really important. It's not, but I like the way that you've extended that to say it's not just about understanding her own history and the history, but having a much more broader aspects of what has happened to different people at different times throughout history, so that we're not likely to repeat the same mistakes or problems of the past.
Yeah.
I'm going to invite William Acker, who says he has a question, and then Sherilyn.
Thank you, Wayne. Yeah, thank you, Marian.
Hi, William. Hello.
Hi. Yeah, I wonder if you can speak around whether networks have played any role in your career development, or whether it is very much an individual thing. So, because I suppose we're in academia, it's not so much sure about like the medical profession, whether there are medical networks that you're a part of that have helped your development, and what would you say about those networks? And then have there been other networks outside of your work that you feel have helped you and given you support in terms of what you've been doing and how you've advanced in your career?
Yeah, thanks for your question, William. Yeah, so I think definitely from an academic perspective, I think networking is very important. And whenever we go to these academic conferences, or you actually don't really go sit around in the sessions that much. You need to, you're meant to go speak to people and network, and that's it is important. And I think that's where I had a lot of my opportunities was, in terms of research, it was almost kind of given to you when you're in a certain network. Opportunities, left, right, and center, but it's just a matter of if you can take that workload on. So I think definitely being in a network, and rheumatology itself is quite a small network. So, it's almost like call a friend, this person can do that. And it almost sounds wrong, but the reality of the world is that there is a certain percentage, as much as competitive as you like, there is definitely an element of kind of, someone saying you can do this, or you can't do this, or she's terrible, or whatever. I think those things are important. So in terms of academic, I think it is important, and also collaboration and things, and doing projects much easier if you know people in the setup. The other thing in terms of friendships and settling down, I must say in the UK I didn't really have a network of friends. I think I realized that when I came here, I hung on to a lot of my friendships from South Africa and my childhood friendships, and I think as I worked, I developed friendships, and I've tried to maintain them. But as you know, life gets very busy, and you try and kind of maintain that, but it's not always easy. But I think it's just being truthful to the few people that you meet make a huge difference in terms of friendships. I realized that you don't need many Facebook friends. Like, you might have 300 on your list, but really your genuine friends, you're not communicating through Facebook, are we? So I think, yeah, it's just that's where I've built my network of friendships. I think, being very true to the ones that that make time for me, and vice versa. Yeah, I hope I answered your question, William. I don't know.
No, you did. Thanks very much.
Yeah.
Thank you.
Brilliant.
Yeah, thank you.
Yeah. Hi, Marian. Just a quick question. I think you mentioned earlier about taking on a role at Oxford. Am I right in thinking that that was a bit more kind of academic research type role, or was that purely clinical?
So it started off, hi, thanks for your question, Cheryl. So yeah, it started off as a clinical. So there was basically my visa ran out, so I needed a job. I think what happened was that they were looking for a clinical registrar to replace someone. So I started off, so I went for the interview, and I got the job. So I was very grateful, because it was a non-training job at that time. So I qualified for that job. So, but then that kind of set my platform, and whilst I was there, that's what I was saying about the network of opportunities. I was offered to then move into a clinical fellow job in terms of research. So I did research for about 1.5 years there, and my intention was not to be an academic, but I was given the opportunity, and I suppose it answered if I did want to do academia or not. And I realized that it was very hard work. So it was
so just on that note, then I just wondered whether your kind of experiences or your feelings of belonging were any different in that academic environment versus the clinical environment that you're working in now.
Yeah, it is different, isn't it? I think we were part of a research group, so I think it's interesting because Prof used to have to pull me out of the clinical meetings and say, Marian, you need to be in the research meeting. I was like, I don't understand, but okay, I'll go. But there's definitely, you know, when you're in that research network, you almost get to learn about all the other academics who are doing research, and you get to attend different meetings. And I think I definitely felt, you know, because I was a researcher, you know, I was able to link in with the research group and get on with them. Whereas I think when I was doing the clinical, but just before I joined the research group, I didn't really understand and I didn't know how to communicate with them. But it definitely made a difference in that transition. So, and I think having the unique role of being a clinical researcher in a way, I think I needed both to be able to make the work that I was doing work in a way. So I kind of needed to be part of both groups. But you know, it was a wonderful time. It was really a wonderful time to kind of meet so many people. But yeah, I hope I answered your question. Is that okay?
Yeah, that's
thank
brilliant.
you.
Yeah.
There's another question which kind of follows on from that, which Medina would like to ask. So I'm going to invite Medina at this moment to ask her question, which is kind of like follows on slightly, but it's slightly different.
Hi, yeah, thanks Wayne for bringing me in. Thanks Marian for the really interesting discussion. So my question is about kind of your experience with medical education, whether that's your kind of education when you were in medical school or with kind of current students now. And do you feel that medical education is diverse enough with regards to accounting for differences in, for example, socio-economic differences or cultural differences, or even things like I saw recently that a medical student created a handbook looking at differences between the impact of skin color on different skin conditions, and just what your experiences with education was.
Yeah, thank you for your question, Medina. A great one. I think I say this all the time. In terms of medical education, I always say this to the students, that the data and the publication and all the textbooks are written depending on which country the data is published. And obviously there's a publication bias. And like this condition that Wayne struggles to talk about, ankylosing spondylitis, I always say to them that the data is all from very kind of European, Western society. So it cannot be applied to the African subcontinent, you know, South America, Asia. So it's, you know, so that's why I think I always say to the patient, to the students that, you know, when you read the data and these classification criteria which have been developed in the first world countries. So we need to be very mindful of that. So I would say that I think there is a need to identify that and to state that to the students. But I don't think it's everywhere, isn't it? I think they read textbooks and they assume that is the data, that is the right information. So I think that there is a need for that. And I mean, how interesting on the different skin colors and the effects of different conditions. I think we definitely need more of that. Because the stuff that they are reading on is very skewed, you know, depending on where the publications are. I don't know if you agree with me on that one, and I don't know how you found that yourself. So I do try and incorporate that in my teaching. And obviously in South Africa, our teaching there, some of the we actually had subjects on human behavioral sciences, which looked at the different socioeconomic populations. So as medical students, we were made to go to the rural areas to work, because that was the need, you know, community-based medicine. We had to work in those rural areas. So I think that the medical school education in South Africa did include the different socioeconomic statuses and and the different races, but I'm not sure about the UK education here, because I only get to teach the kind of the final year medical students, so I'm not sure what they're learning in the undergraduate time. Yeah.
As I don't know if Medina wants to come in and follow up on her point, but it is a very good point which you make about the publications and who's responsible for almost like gatekeeping what is published, what is out there, and that in itself can, as you said, publication bias. And as Medina rightly highlighted, with the situation with I think it was a second year medical student who questioned why it was that the skin conditions were only ever showing white skin and not different shades of brown, and the problems which that can result in getting correct diagnosis. Because
I feel unskilled about that. Do you know what I mean? Because we weren't taught about the problems, you know, say in dark skinned individuals, what conditions can one get from that, you know? So it is that I don't feel I'm trained adequately for that. Yeah, absolutely. It is different pathologies happening in different ethnic groups. Which may not be published or not taught. And
because that's it's even just thinking about, so when we're talking about diversity and inclusion, it's something which may seem as simple as that, but it can have such knock-on effects in ensuring that you're getting the right kind of treatment, for example.
Absolutely.
So it is vital that, I think it goes back to the point that you made at the start, which is about valuing people, or valuing the differences that people have, and valuing the individuality of people, to ensure that we're not missing something which might be very important to that person or to that group of people. You see?
Yes.
I've got one final question. Sorry. Cephas has his hand up. Sorry. I haven't been looking in that direction.
Hello.
Sorry. Cephas, do you want to come in with your question?
Yes, please.
Come on in.
Good afternoon, Mariam.
Hi, Cephas. Hello.
My question is basically about how often were people asking you, where are you from? Which country are you from? Or, you know, are you sorts and sorts? How was your reaction when you felt that at the very first time when you came to the UK?
Yeah, it's I think that the assumption is that I'm always Chinese. I think they always say, "Oh, you're from Malaysia or from China or something." But and then I always have to say to them, "I'm actually South African," and I feel South African. I always tell them, you know, I feel African. I was brought up there, so it really confuses them when I say that. So I always start off. So I've had to start, and I think in the beginning of my thing, I would say to them, "I'm a bit confusing," you know. I would just joke back and say, I'm a bit confused, you know, I am from South Africa, but it does get annoying because the presumption is that I am obviously from Malaysia or China. Yeah.
Thank you.
Thank you. Yeah.
Just, I did say that it was my final question, but I'm just thinking with regards to the point which you just made. Did you have any problems with this might sound a bit strange, relating to other Chinese people, for example, because your frames of reference are different, because having grown up in South Africa and not in China, is there any kind of differences that you experience from that point of view?
Yeah, so I think, absolutely, I think it's really funny because I think in South Africa, my mum will call me a banana. So I'm kind of like, because I'm yellow on the outside, but very white on the inside. But actually, sometimes I'm different ripeness of banana, right? But I think there is definitely, I mean, even when growing up in South Africa, there were Chinese who grew up in South Africa, and I think I relate most to them because we obviously grew up in the South African environment. But there were, you know, Chinese, Taiwanese, whatever, people who came from abroad and then came much later on. And they did struggle to settle down. You know, I found that they settled down, but I think I was still interested in knowing what they were doing and their food, and you know what music they listened to and what soap operas they were watching. And you know, it is different, but I think they do engage differently. So I wouldn't say I hung out always with the South African Chinese, if I can say. I think I wanted to understand everyone, and I was more of a bring people together. Let's get to know each other, but also understand we might approach things differently because of our background upbringing. So you know, even within the Chinese, even though I'm not ethnically Chinese, we are different. So yeah, coming to the UK, I find that the Chinese people, interestingly, are not as inclusive. In fact, they shy away from things, whereas in the South Africa, we tend to be out there and integrate ourselves. So I don't know if that's a generational thing. It's interesting. It is interesting. Yeah, I almost find them a few generations behind here. Yeah.
Okay.
Yeah.
That's very interesting. I've kind of like alluded to my final question because I asked you what you would want to see your daughter's generation. But I'm going to ask my final question because I do it most weeks. Is what advice would you give to your 16-year-old self or your younger self?
Don't work so hard. I think, I think that's what I probably would have said. I would have said, you know, don't take oneself too seriously or don't take people too personally. I think, you know, do what you can. But I think if I could have done it, I probably would have spent more time traveling. I think that's probably what I would have done. And because I like and understand so many different cultures and I want to explore so many places and work in different countries, I think that's what I would have said. I probably would have said, don't settle down so quickly in, say, the UK, which I have now. I don't think I would ever look back and I regret, because I've been given some very wonderful opportunities and it's made me grow as a person. But I think if I had that little bit more time, I wish I would have done a few more plays. But then I might never settle down.
No, Marian, thank you very much for your candid interview this week. I'm going to just advertise what's happening next, and Marian will be around for our little after party for those who want to stay around. But let me just let you know what's happening for next week as well. So next week we will be having, just pull this up. Next week we will be having Rachel Boyle, who is a senior lecturer in education and specialising in race and ethnicity at Leeds Beckett University. So that will be 12:30 till 1:15 next week, Friday. So if you can join us then, that will be absolutely brilliant. So I just want to say once again, thank you, Marian, for being with us today. It's been a really insightful discussion, and for everyone else, thank you for coming, and I will see you again next week.